all across the base, straight down to the table, apex straight down to the table. Mistake a lot of people make is they're doing something like this. They're not going straight down. So if I say, well, this is harder to push on, that means posterior. If I say there's no difference between right and left, sacral base has gone posterior. If I say this is harder, sacral base, the base has gone anterior. If there's no real difference, don't sit there and think about it so much. There either is a difference or there isn't. Okay? So, if I push on the top, push on the top, push on the bottom, there's a difference. This is harder. Now I push on, this is another mistake you make. They're going something like this. Go straight down on part of the base, straight down. And if this is harder, that means I need to hold the phone this way. The mistake people make is they do this. Well, this is harder, so they hold the phone and go like this. No. Harder means it's doing that. The sacrum is turning to the left of an axis that starts on the right, which means see a flexion test should be positive on the right. If I push on this, and push on that, I'm sorry, do your half, and I say it's harder up top. And then quarter, it's harder over here. That means the sacrum is now turning to the left, about an axis that starts on the right. See a flexion test positive on the left. Top, bottom, it's harder back here. Left, right, the left is harder. The only way you describe that coming back is not by picking that corner up, it's by grabbing the other two corners and tilting it back. The sacrum is turned to the left about an axis that starts on the left, meaning this SI joint is getting tight and it's rotating around the joint. I go top, I go bottom. Bottom's harder. Right side is harder. And the way you describe that is by holding it like this. It is turned to the right, first letter, around an axis that starts on the right. Most of your people are going to be one of those 6 things. It is possible to have somebody where you go top, bottom, no difference. That means either it's rotated this way or it's rotated that way. Which side's the problem? See the flexion test. It's going anterior on the left, it's going posterior on the left, see the flexion test, and probably pain on the left, because this is not a normal anatomical movement. If it is, and in all of those, when your thumbs come under, they're kind of equal. The part where you're having to stare at your thumbs, and it's kind of equal. The part where you go, the way you evaluate this is to go underneath, which people don't want to do. They're being squeamish about going under somebody's butt. Either do the test or don't do it. So you come off the sacrum, go straight under and push up. You're doing it for 2 seconds, no problem. The part where you do that and it's one thumb off, well then you have, this is shoved down or it's been shoved up. It's a dislocation. So this is USF, this is USC. We used to call this a superior shear, inferior shear. And the names got fancy and complicated, just to make life complicated. Unilateral sacral extension, unilateral sacral flexion. What's the axis? There is none. It's been dislocated. You have to do muscle energy and push it down. If it's down, you gotta do muscle energy and push it up. Okay? If you see that, they're in pain. They are not walking around with a happy face or a kind of pretend face.